Blood pressure is an important data point in many patients and is commonly used under general anesthesia. Blood pressure is the force exerted by blood on the arterial walls. It's generated by the pumping force of the heart or cardiac output and the resistance of the blood vessels, so systemic vascular resistance. It's measured in millimeters of mercury. The components of blood pressure are the systolic pressure, that is the pressure during ventricular contraction, the diastolic pressure, which is the pressure during ventricular relaxation, and the mean arterial pressure, which is the average pressure driving blood to the organs. The mean arterial pressure is the most important for tissue perfusion. Blood pressure tells us how well tissues and organs are perfused, the cardiovascular stability of the patient, and the response to anesthesia and certain drugs. Common situations where blood pressure is monitored would be anesthesia, critically ill patients, patients with kidney disease or heart disease, and then any animal that is in shock or has significant trauma. Adequate blood pressure is required for delivery of oxygen and nutrients to the tissues. It's also required to remove waste products from the tissues. Blood pressure that is too low or too high can cause organ damage. Consequences of low blood pressure include acute kidney injury, altered mentation or syncope, myocardial ischemia, and ileus or mucosal damage to the GI tract. Hypotension is very common during anesthesia, secondary to their anesthetic drugs. Hypertension causes excessive pressure on vessels and can damage the eyes, kidneys, brain, and heart, among others. Hypertension is common in cats with CKD, so chronic kidney disease, or hyperthyroidism. There are three main methods used for monitoring blood pressure in veterinary medicine. The first is a Doppler blood pressure. Second, oscillometric blood pressure monitoring. And the last is direct or invasive blood pressure monitoring. Each has advantages as well as limitations. When placing a blood pressure cuff, the cuff should be placed on the forelimb or the hind limb, typically above the first major joints, so above the carpus or above the hock, and can also be placed on the tail, especially in cats. The cuff is typically or ideally would be at the level of the heart, and it should be snug but not too tight. The width of the cuff, or the shorter side of the cuff, should be approximately 40% of the circumference of the limb. If the cuff is too small, you can get falsely high blood pressure readings, whereas if a cuff is too large, you can get falsely low blood pressure readings. So choosing the correct size cuff for your patient is critical for accuracy of blood pressure readings. When using a Doppler for blood pressure monitoring, it uses ultrasonic technology to detect blood flow and measures systolic pressure only. A cuff is placed proximal to a small probe that is placed over an artery. The cuff is then inflated until the sound disappears from the vessel, and at the time that the cuff is deflated and the sound returns, that corresponds to systolic blood pressure. It's a fairly inexpensive method for determining blood pressure, and it's fairly quick to place and then use. However, you only get a systolic reading, so you don't get that mean arterial or diastolic blood pressure reading. And in cats or smaller patients, it's actually somewhere between the mean arterial pressure and the systolic arterial pressure. So we don't have a precise reading in those cases. It does require a quiet environment as you are listening for the return of that sound or the return of the pulse sound. The oscillometric blood pressure monitor requires placing a cuff over an arterial an artery and will inflate the cuff. The machine will inflate the cuff, and the machine itself will calculate the systolic, diastolic, and mean arterial pressures. So you do get all three readings. It's commonly used in the automated blood pressure machines. It's easy to use. It does get automated readings and provides the mean arterial pressure. However, as patients are smaller or hypotensive or even moving a little bit, it can be less accurate. Lastly, we can use direct or invasive blood pressure monitoring, where a catheter is placed directly into an artery. It's connected to a pressure transducer and allows for a continuous blood pressure waveform. You do get the systolic, diastolic, and mean in real time with this method. Advantages is that it's very accurate, you get real-time monitoring, and it's ideal for critical or anesthetized patients. However, it is invasive and requires placing a catheter into a vessel, which requires technical skill and does have risks, including infection and hemorrhage. Normal blood pressure values in dogs and cats can be seen on the screen and should be taken a little bit with a grain of salt because it is dependent on the patient and the clinical context of that individual. So a couple of key takeaways. Blood pressure reflects organ perfusion. Both hypotension and hypertension can be problematic. It's essential to place the correct size cuff on your patient. There are multiple methods that can be used, and monitoring blood pressure improves patient safety and improves outcomes for the patient.